The concept of alternating syndromes, Weber's, Miyard-Gubler, and Fauville syndromes. Alternating hemiplegia is a rare neurological disorder that develops in childhood, most often before the child is 18 months old. The disorder is characterized by recurrent episodes of paralysis that involve one or both sides of the body, multiple limbs, or a single limb. The paralysis may affect different parts of the body at different times and may be brief or last for several days. Oftentimes, these episodes will resolve after sleep. Alternating hemiplegia is primarily caused by mutations in the ATP1A3 gene. Occasionally, a mutation in the ATP1A2 gene is involved in this condition. These genes provide instructions for making very similar proteins. Mutations in these genes reduce the activity of an enzyme called sodium potassium ATPase, which affects the signals that control muscle movement. However, it's not yet clear how the reduced enzyme activity leads to the symptoms of the disorder. Weber syndrome. Weber syndrome is a neurological condition caused by an injury to the midbrain, the uppermost section of the brain stem. It's usually caused by a stroke, infarction, but in rare cases, Weber syndrome can also be caused by a brain tumor, a traumatic injury, or infection. Symptoms. Weber syndrome can cause sudden weakness and vision changes, usually blurred or double vision and eyelid droppiness. Diagnosis. One tool that has become the key in diagnosing midbrain strokes is diffusion weight imaging, a form of magnetic resonance imaging, MRI. Treat- Treatment. Physical therapy aids in stimulating healing of the brain injury and will likely be a key part of treatment. Physical therapy can also optimize your ability to move the muscles of your eye in addition to those elsewhere in your body, despite any lingering brain damage. As you can see in the image, there are manifestations at different levels of midbrain. We can see the oculomotor nucleus and the nerve. Motor weakness is contralateral hemiplegia, upper and lower extremity. And we also have ipsilateral lateral case weakness and diplopia. The eye movements, patient is unable to move the eye up and down or medially in the ipsilateral side. Next, Miyard-Gubler syndrome is a clinical syndrome which occurs following lesions involving the ventral portion of the caudal pons, resulting in classic clinical features such as ipsilateral abducens and facial nerve palsy and contralateral hemiparesis. Miyard-Gubler syndrome, it is a unilateral lesion of the ventrocaudal pons, may involve the basis pontis and the fascicles of cranial nerve 6 and 7. The involvement results in the following. Contralateral hemiplegia, sparing the face, is due to pyramidal tract involvement. Ipsilateral rectus paresis, cranial nerve 6 with diplopia, that is accumulated when the patient looks towards the lesion. Ipsilateral peripheral facial paresis is cranial nerve 7. Next. Symptoms result from the functional loss of several anatomical structures of the pons, including the sixth and the seventh cranial nerves and fibers of the corticospinal tract. This syndrome is easier to diagnose due to the technical advances in the brain imaging, such as CT scan and MRI. It can also be identified based on the symptoms described above. Fauville syndrome is caused by the blockage of the perforating branches of the basilar artery in the region of the brainstem known as the pons. It is frequently most caused by vascular involving the dorsal pons. Next. Differential diagnosis includes any structural lesion that can localize to the inferomedial area of the pons, which can include neoplastic processes, hemorrhages, inflammatory disorders, and vascular malformations such as arteriovenous malformation. Treatment. The mainstay treatment of lacunar strokes is antiplatelet therapy and control of vascular risk factors for secondary prevention.